Hey everybody, this is John Willamy. I'm the director of the Good Samaritan Center. I am self-filming this video. I don't want to be too close to anyone without a mask. I'm here to give you a quick 5-minute tour of the Good Samaritan Center and let you see the work we do with our patients. The first thing you notice when you drive up is that our building is beautiful. We have 15 volunteers who come out here every month to work on our landscaping. You can also see there aren't many cars in the parking lot right now because I'm doing this early in the day. So here we are in the lobby, and you will see immediately that our founding director, Sarah Allerkamp, wanted this to be the prettiest doctor's office in town, and she succeeded. Well, she and the community that helped raise the money for it. You can see we have these big, beautiful picture windows that look at a natural habitat out back. We have this tapestry that Judy Hutcherson donated, and then we have this beautiful piece of art that was custom made for this room. We also have a great chapel. People can come and sit and meditate and use how they will. We also have staff prayer time on Tuesday mornings in this room. Let me tell you a little bit about where the chapel came from. Mary Ronslaben adopted this chapel, and she commissioned the stained glass and the cross, and even found these old pews in an old Baptist church in Llano. You can see that when patients come here, they don't necessarily feel like they're getting charitable care. One of our new additions to the building is this glass. That is one of the new safety measures we have here at the center for COVID-19. So while I'm walking you back through the medical clinic part, let me tell you about who we help. Between the ages of 18 and 65, 1 out of every 3 people, 1/3 of our population in our county, does not have health insurance. So we are performing a vital service for the people who come to us for their health care as their medical home. And now you can see this is what an exam room looks like, and it looks remarkably like your doctor's office. Exam table, blood pressure cuffs, temperatures, and all of the medical equipment and supplies you would find in a normal doctor's office. Now, thanks to several volunteers back in 2004, we actually have a functioning dental clinic as well. We have one of our dental operatories where we have a chair, and then we have a digital x-ray that swings between this chair and the other chair, fillings and extractions on this side, cleanings over here. In addition to Dr. Coley, who is our dentist here 3 days a week, we also have 4 dentists who give up half a day a month each from their private practice to come and see our patients. We also have 2 hygienists who come and do cleanings for our patients as well. It is very unique for a community this small to have this sort of dental service. One of the other programs I want to tell you about is our mental health counseling program. Once a week, we have a bilingual LPC come to our clinic, and she works with patients. Lately, because of COVID, she's been working with them via video. She's here once a week working with patients and helping them through some of the difficult traumas and situations that they're going through in their lives, whether it's family counseling, whether it's personal trauma, whether it's just needing somebody to talk to as they deal with the stress in their lives. We have that program available too. A wonderful service for our community is our community health worker program. So this is Delia sitting in her office. Since I don't have my mask on, I'm gonna stay a good distance away from her. Delia is the one who gets us out of the building. She does public health screenings, home visits. She helps coordinate programs like Prevent Blindness Texas, the Central Texas Food Bank, kidney screenings, and mammogram screenings. She partners with the Wellness Center at Hill Country Memorial. She partners with the Wesley Nurse at Methodist Healthcare Ministries. Also, when we have patients in here, she is our diabetes educator, so she does one-on-one education sessions with our diabetics and hypertensives to help them manage their chronic diseases, stay healthy, stay at work, and stay taking care of their families. Now let me tell you about a few more of the services that we do. One of the things is prescription assistance. If anybody out there has asthma or diabetes, you know how expensive it is to get those medications every month. Well, the pharmaceutical companies will provide those medications for free if you qualify economically. So we have somebody on staff, Tatiana Neri, who does the paperwork for those patients, and they get their medication sent for free from the pharmaceutical companies. We only charge the patients a $5 administrative fee when that medication comes in for a 90-day supply. So for example, if you have asthma and you need Advair, then Advair might cost you $400 a month. But if Tatiana orders it for you, you can get a 3-month supply for $5, $1,200 worth of Advair for $5. We have it set up on a sliding scale so that none of our patients pay more than $100 a year for the medications that they need. And of course, we could not do this without the help of the local specialists in town, Hill Country Memorial, and everybody else. If you need an operation, if you need a podiatrist, if you need a gastroenterologist, we have the local specialists here who will accept our referrals. We then send you over there as a patient. You can get the procedure done. The hospital works with you, the anesthesia works with you, and we make it all very affordable so that we can access just about any of the healthcare services that are available in Fredericksburg for our patients. But that is only because everybody in this town is so generous. So we have medical appointments, dental appointments, mental health counseling. We have the prescription assistance program. We have the community health worker. So we are as comprehensive a medical home as you will find in any community for our patients. One of the last things to tell you about, and one of the most common questions I get, is how do y'all get your support? How are you funded? We have an interesting balance where our budget this year and probably next year will be about $1.1 million. About 15% of that will come from patient fees. About 5% will come from mental health and developmental disabilities. The agency used to be known as MHMR. They rent space in our building. About 5% of our income comes from that rental income. About 20% comes from private foundation grants, and the other 60% comes from just private donations. This year it'll be about $700,000 will come from about 900 donors who support us and reach out to us and really help us. They are the reason we are able to be here for our patients. It's an amazing partnership with this community, and it makes it what it is. I'd be remiss if I didn't talk about our volunteers. We have about 40 people who used to come to us every week before COVID, and over the course of a month, we'd get about 90 volunteers, and that included the landscapers and everybody. Now, with COVID, we have about 10 people coming every week to help us support our operations. They work at the front desk, they work in the medication room, they help in the dental clinic, they help with some of the back office work. They are amazing, and even a couple of them are working from home, but still doing the functions that they did when they used to come in here. We could absolutely not do what we do without our volunteers. We are a community effort. We are our community's answer to the problems in our healthcare system. We have a lot of uninsured people. We have a lot of people who need help. We are their medical home for the doctor, for the dentist, and also for mental health counseling. So if you want to know how to get involved with our program, please go to www.goodsamfbg.org, fill out the information form, sign up for our newsletter, sign up for more information about being a volunteer, and of course you can donate to support our work. Please contact us if you have any questions, or if you know of anyone you think needs our services, please send them our way. Thank you so much for joining me for this quick tour of the Good Samaritan Center. I hope you have a great day.